there are a lot of complications that comes with pregnancy because the bones are not mature. We're talking about you can give birth properly and then maybe have the fistula problems. And there's also postpartum depression. I mean, this can happen even to the older women. So what more a young girl who has no support and hasn't matured mentally and physically. My advice to the young girls, teenagers, it would be like they shouldn't get pregnant while they're still schooling, because being a mom, you have somebody that you will be looking up to you. So if you can't even help yourself, and then how are you going to help somebody else?
We have so many cases coming for post-abortion care. Like in 24 hours, we usually have at least 14 cases. So like in a year, we do have 1,000 something cases that have come to seek for post-abortion care, which means there are a lot of unsafe abortions that is happening in the communities. As a facility, we offer post-abortion care services safely using medical procedures or surgical procedures. But then we do have cases that in case somebody gets pregnant unintended and doesn't know where to get the help, they just abort it unsafely and come to the hospital with complications that also lead to some other complications as well that can lead, I think, to the removal of the uteruses because they've used the unsafe methods to remove that pregnancy.
We have to address the topic of abortion. We cannot allow it to remain unaddressed because it's a socially sensitive topic. And to address it, we have to look at the facts. And what are the facts? Legal restrictions do not necessarily limit abortions. They make abortions more unsafe. And the more abortions are unsafe, the more complications we see, the more money is spent in post-abortion care. And therefore, there's need to address the unmet need of safe abortion care so that women and girls who are in need of safe abortion could be able to access it.
Unsafe abortion is a major contributor to maternal deaths in this country. And unless these unsafe abortions are prevented, then the needless deaths that are happening among girls and women in this country will continue. The avoidable complications, ill health, those will continue. The other thing that we need to appreciate is that a woman who has made a decision to procure an abortion, whether it is safe or unsafe, they will go ahead. And it's not the availability of safe abortion that makes women choose to abort. It's the social, cultural circumstance or the social context in which they find themselves in that forces them to procure an abortion.
When it comes to advocacy around implementation of laws and policies, it's not only advocacy, but also the issues of amendment of laws. This is where now as CSOs will want to fight for legalization of safe abortion bill, of which we already started working on it, but we know we still have a long way to go. So we are trying our best to come up with different strategies, various strategies that would allow us, that would give our parliamentarians some power to legalize or to table the termination of abortion.
In the first place, we need interventions that will be targeting and addressing to the challenges. So the most of all, I think we should start with the policy part. We need to have a policy. The policy that will actually highlight how do we address the challenges that we have. Apart from the challenges, we also need to have the strategic direction, the breaking down on who does what, at what level.
The Unintended Pregnancies and Abortion Dissemination Studies Project is a one-year project, started implementation in October 2022 up to October 2023. And this project was conceptualized on the idea that researchers normally generate evidence, but they do not engage in a strategic manner with the right people, including decision makers. And so for this particular project, we are encouraging researchers from APHRC and Guttmacher Institute to share or communicate their research findings with the stakeholders such as the policymakers with regards to unintended pregnancies and abortion in Kenya and Malawi.